So good afternoon, happy Lodi to all of you, and thank you for joining us. And we now revise the Psychiatry MCQs as the FMG 2025. I am Dr. Sandeep Govil, and hope you all will join. So this is the first question that 25-year-old man previously diagnosed with a psychiatric disorder. Now he has been aggressive, speaking rapidly, sleeping very less, also exhibit hyperactive behavior after discontinuing his prescribed medication. What is the most likely diagnosis? We know it's a bipolar disorder. We have learned that bipolar disorder are basically the psychiatric illnesses with the bipolar mood disorder, or what is being called as the bipolar affective disorder, shortly being called as BPAD. As the name suggests that it is the saddest mood, it is the happiest mood. So it's an episodic illness when both the phase comes up, and that is what is being called as the bipolar. The upper phase is called mania, the lower being called depression, and we all know it's a episodic illness with inter-episodic complete recovery. So to remind you that this is one of the questions we have discussed in our 100 सवाल बेमिसाल. So in the revision of the FMG examination which we have been doing at Medway, I have covered this topic and we have learned this. So that way, out of these 7 questions, almost all are there, but just first one to see. Next is that a man 45-year-old come to the hospital. That is a loving MCQ of the FMG. As I told you that in 2005 onwards to 2012, for 7 years the loving question was the dissociative, the amnesia and dissociative trance and possession. But now the loving question of the FMG is undoubtedly the alcohol. So there is an MCQ almost always about the alcohol. So we know that some man is not able to recognize his family members. His last alcohol intake was 48 hours ago, and we know he's seeing snakes. So it's a delirium tremens. We all have learned that alcohol is in psychosis. In psychosis, we all know the orientation is usually intact. Orientation is usually intact. Since he is not able to recognize his family member, and we know in alcohol withdrawal, we know there is a delirium tremens. We know it is called delirium tremens because it is seen in the delirium plus tremors plus autonomic hyperactivity. If you remember, it is also MCQ involved in the 100 सवाल बेमिसाल. The revision FMG we have done, that has also been there. So that is the beauty we have seen. That's up. I'm sorry, I'm not able to see you now. Sorry. ओके, आप लोग हैं, आई एम नॉट एबल टू सी, जस्ट लेट मी लुक, 4 लोग रह गए अभी. ओके, so delirium plus tremors per ordinary activity. So delirium is another name for the acute confusional state, and there is a visual hallucination, transient delusion. So that all is there. Okay. चलिए डॉक्टर साहब, I'm unable to see your answer. Transient delusion and there is a picking behavior, called as the flocculations, and drug of choice is something like alcohol, that is benzodiazepine. Drug of alcohol is something like that is the benzodiazepine. That's I'm not able to somehow see. Please ask any query. Okay, so that's all about the delirium tremens, and that's about the question. So that's it. Now, young female present with the episodes of binge eating followed by self-induced vomiting, and she is most likely to be following acid-base disturbances. We know in the bulimia nervosa or anorexia nervosa, we commonly see the metabolic alkalosis because all the acid has been taken out by the vomiting. So we have the metabolic alkalosis. ठीक है डॉक्टर साहब. And we have learned that the anorexia nervosa and bulimia nervosa, we have learned the so it is basically the feeling that person is, fat despite having less than 15% of normal body weight. Okay, that is what is the okay. Here the basically it's a preoccupation with the food. Here there is a decreased weight. Here there is a normal weight. Binge eating purging can be there. It is of two types. Restrictive type, binge eating purging type. Here there is a always compensatory mechanism. So So usually it's a binge eating. ठीक है जी. So that is the point. Now that's a question. We have learned that a doctor is asking a patient about her age. The patient responding, doctor, I am from a village. We had a very young age, we are married, who is just 5 years older to me. Then I have 2 kids when I was around 18 or something. Now look at the older sister. I am just 32. So it is basically, we know it is a circumstantiality. We know, remember that it's a unnecessary, tedious, boring details are conveyed before conveying actual thoughts. So it is again a question we have discussed in the 100 सवाल बेमिसाल, and I am proud to say so because there was a student who came to me 2 days before the examination and said, sir, time is less, can I only go through the 100 सवाल बेमिसाल? I said yes, and thankfully all the questions have been there from it only. Tangentiality, we know it's a perpendicular turn. Okay, it's a perpendicular turn. Derailment, we all know that the person doesn't derail, it does derailment. And then last we have the flight of ideas. Flight of ideas, there is a superficial association found in mania. Derailment is that from one topic to another topic. Shifting from one topic to another topic, that's a derailment. Then we have affective flattening. Again, doubts up. Trust me, this is a question we have discussed. We have discussed in detail, and it is in the one of the question from the 100 सवाल बेमिसाल. So just by seeing that 2 hours of video, you can be coming out of the FMGE psychiatry question. At least 7 questions has been asked with flying colors, and just that okay. So ठीक है डॉक्टर साहब, देख नहीं पा रहे हैं हम आपको, चलिए, नो प्रॉब्लम. सो दैट इज द top message is not able to see. Okay, leave it. So it's a negative symptom, and we have discussed that this is a likely question because nowadays the schizophrenia is nothing but the cluster of positive and negative symptom, and we have discussed that Nancy Andreasen 1960 1980 has classified the schizophrenia, the symptoms of schizophrenia, into positive, and this also we have discussed in detail in our negative symptom, and cognitive symptom. We have discussed that positive symptom means that any violence, nobody hearing voices, I am hearing voices, nobody suspicious, I am suspicious that there are camera everywhere. So delusion, hallucination, violence is a positive symptom. Negative means which all of us have but they don't have. What all of us have, we all have some motivation to live. They are a motivation. We enjoy the pleasure, they can't enjoy the pleasure. A motivation, anhedonia. We all socialize, we all make friends and create enemies to live happily in this world. They do not. We all speak language and communicate, they do not speak language. We all have the attention to focus, they have attentional deficits. And we all have the emotions to display, they have the affective blunting. So affective blunting, affective flattening is a negative symptom. Cognitive is lack of the executive functioning or memory. So they cannot execute any function or do the okay. So that's how you can chat. You can ask queries. I'm sorry I'm not able to see what actually been going on, but that's great. You all have joined, that's nice. Okay. Now a lady present to the hospital after having a fight with her husband. She reported that she is unable to speak. This also we have discussed also. This has been also done in the revision class, and I told you this is a topic which is being asked as the most loving MCQ of the FMG. So alcohol and alcohol withdrawal and this topic of dissociative disorder has been a loving MCQ of the FMG. Now it has revisited now. All neurological and physical symptoms are normal. She does not seem to be concerned about her health status. La bella we know is a French language word meaning emotional indifference. Emotions are not matching with the loss. So somebody saying that's how I become blind, I can't see, and he say so smilingly कि that's अंधा हो गया मैं तो लकवा मार गया मेरे को सुबह तक ठीक था. So smiling he say you become troubled कि that's ये क्या है. So that's a la bella indifference. You remember in the dissociative amnesia and dissociative fugue we have discussed that dissociative amnesia, dissociative fugue, that's a amnesia is a loss of recent memory. There is a stressful event and there is a loss of memory. And fugue is a plus travel to uncommon place. And we have discussed that in the convergent disorder or what has been called as the dissociative disorder. That basically how would you identify? कैसे पहचानते हो डॉक्टर साहब? How would you identify or what is being called as previously hysteria? There are astasia, abasia and la bella indifference. What is astasia, abasia? It's a loss of function despite normal anatomy and physiology. Okay. And la bella we have learned, it's a French language word meaning the emotional indifference. Emotions are not matching the loss. And we have learned there are three gains: primary gain, secondary gain, and tertiary gain. Primary gain is a relief from unconscious anxiety. Some benefit, some extra care I got is a secondary gain. And gain to family is a tertiary gain by my symptoms. So that is what we have learned about the conversion disorder, or previously been called hysteria, and now the dissociative disorder. So this is also being discussed twice. First in our FMG revision questions, which has been held for 2.5 hours, and it is the loving MCQ of the FMG. So I always discuss in the revision. So 100 सवाल बेमिसाल में this was also a topic we have discussed. Now this is the last question. A woman with diagnosed with a schizophrenia, that olanzapine she has been taking. Now she discontinued the treatment. Which of the following is the most likely reason for the discontinuation? So it's basic understanding. Again we have discussed this. We know they are the side effects of the typical antipsychotic. Olanzapine being the atypical, and it is the most culprit drug for the weight gain and hyperlipidemia. You remember we have discussed that among the risperidone, olanzapine, quetiapine, clozapine, side effects are the sedation, weight gain, and most culprit for weight gain is olanzapine. Second most culprit. So if you see just do the, so I thank God to keep my words, and thank you for trusting us, because I told you that two students, they have come to us and they asked me that, sir, we don't have time to read psychiatry now. Can we just see your 100 सवाल बेमिसाल? So I told yes, and they must be feeling good, because all 7 MCQs are from our 100 सवाल बेमिसाल. So that is the beauty, and as I told them also that is the power of the short subject. Psychiatry, skin anesthesia, radiology, forensic medicine, orthopedics. If you revise these 5 6 subjects, you will have 30 MCQ for sure. 7 तो आ गए डॉक्टर साहब इस बारी. So 7 के 7 सही and 7 के 7 सवाल. If you really know the concept, it is hardly 7 seconds. So it saves time and it is also scoring. So I wish you good luck again, and thank you so much for watching this. And I would again request to you, please go for the watch the YouTube on the 100 सवाल बेमिसाल, and you will find that these all 7 MCQs are basically being already discussed in detail in the 100 सवाल बेमिसाल, which is just a 2-hour revision class for the psychiatry. So with this, thank you so much Dr. Sahab, and thank you so much Medway for giving me the opportunity to take this class. So all the best and good luck, and I request you again to have a look at the 100 सवाल बेमिसाल so that you can feel the power of experience, and that we have been discussed them in detail thoroughly in revision and saw सवाल बेमिसाल. So good luck. Thank you so much.